Hello, everyone. Thanks so much for joining us for day 2 of the Commit to Connect and Engaged National Summit to Increase Social Connections. I'm Meredith Hanley, a program director at US Aging. As we shared yesterday with the support of the Administration for Community Living, US Aging has the privilege of serving as the coordinating center for Commit to Connect, and we also administer Engaged, which is the National Resource Center for Engaging Older Adults. Commit to Connect and Engaged focus on promoting social connection and addressing social isolation and loneliness, both with their own unique aims and activities. And both Commit to Connect and Engaged have teamed up to co-host this national summit to increase social connections. So today we will continue to dive into the summit's theme on the intersection of technology and advancing social connections. We have 2 fantastic panels that we're so excited for today. One, our first panel will focus on how machine learning can be used to address social health needs. And then the second panel will discuss the future of virtual programming in this post-pandemic era. For those of you who weren't on this summit yesterday, I'll just do a quick recap of housekeeping on how to engage and participate in this summit. To ask questions of speakers, you can use the Zoom Q&A or question and answer button at the bottom of your screen. And we plan to save time at the end of both panels to respond to questions. And we definitely encourage you to type in your questions. That really helps us to tailor the content of the session to meet your interests. There's also, of course, the chat feature where you can engage with the hundreds of colleagues joining you on the summit. If you need technical support, you can use the chat feature and message us as the hosts, and we will do our best to help. You can also notify us that you'd like technical assistance by raising your virtual hand in Zoom. You can use the Zoom platform to raise or lower your hand, or press Alt+Y on your keyboard. Both American Sign Language and Communication Access Real-Time Translation, or CART, captioning services are being provided on the virtual summit. The video stream of an ASL interpreter will be spotlighted so attendees can view the interpreters. And to access a live transcription of the event, all you need to do is click on the CC or Show Captions button in the control bar at the bottom of the Zoom window, or click the URL that was provided in the chat, and then you could open the captioning in a new window if you prefer it that way. Recordings from the full summit, so day 1 and day 2 of this event, will be posted on the Commit to Connect and Engaged websites within the next few days. But before we move into our first panel, I want to give the floor to Katie Clark, a policy analyst with the Administration for Community Living and who oversees ACL's social connection efforts, a few minutes to also share her welcoming remarks. So Katie.
Thank you for the warm welcome, Meredith, and thank you everyone for an engaging and exciting first day of our National Summit to Increase Social Connections yesterday. Once again, my name is Katie Clark, and I lead the U.S. Administration for Community Living's work on social connection, which includes the Commit to Connect initiative. We all have deeply felt the value of social connection in our own lives, families, and communities. The research in the last 4 decades is strong and demonstrates that social connection is as fundamental as food, water, and shelter. People with strong social bonds have a 50% increased likelihood of survival than those who have fewer. We also know that social connection can help prevent heart disease, stroke, dementia, depression, and anxiety. We are energized by all of your interest, your passion, and your work to support and promote social connections and greater health and well-being. Reading through your questions, resources, and ideas in the chat yesterday confirm the relevance of this topic in all of our work. We are so eager for more innovation to share more program examples and even more resources with you today in day 2. I look forward to continuing to engage and connect with you all as we collectively consider how to leverage technology to promote social connections. Today, we will begin our National Summit with highlighting the Virginia Department of Aging and Rehabilitative Services, No Wrong Door Virginia, their online social health connector tool, which uses machine learning to support Virginia residents' social health needs. The Social Health Connector provides a person-centered, customized social health connection plan to individuals based on a series of self-reflective questions. This customized digital tool is designed with older adults, individuals with disabilities, and caregivers in mind. COVID-19 brought a heightened need for programs and services that promote social connection as a social health need. Us at ACL, alongside the HHS Office of the Assistant Secretary of Health, launched a 2020 prize challenge to leverage technology and address this ballooning social isolation epidemic. The goal of this prize challenge was to develop a technology solution to increase access of, awareness to, and use of programming and services to promote social connections at the population level. We called on this solution to be consumer-facing and an application to match people's interests and needs to relevant programs and services in their community. Virginia No Wrong Door and United Way Worldwide won this prize challenge. Through their continued partnership, they have gone above and beyond with this call to action. Today, I am so honored to introduce Sarah Link, Director of No Wrong Door Virginia, and Erica Konsky from No Wrong Door Expansion Specialist, both from No Wrong Door Virginia in the Department for Aging and Rehabilitative Services. Also, Kathy Spanger, Director of 211 Virginia from the Virginia Department of Social Services, Mary Miller, Director of 211 Data Projects, United Way Worldwide, and also Catherine McDonald, Director of Community Outreach and Virginia Commonwealth University. Thank you all for being here, and I so look forward to hearing what you have to share.
Good afternoon. Can everybody hear me?
Yes, we can hear you. I'm not sure we see you yet.
No, it says that the video had stopped.
I think if you'd like to get started, that's fine. At least we can hear you. Oh, there you go. Your video is working now.
Terrific. Well, good afternoon, everyone. Thank you so much. My name is Sarah Link, and I'm Director of No Wrong Door at Virginia Department for Aging and Rehabilitative Services. And it's an absolute pleasure to be here with you today as a part of the National Summit to Increase Social Connectedness. And again, we're presenting to you on our solution and machine learning. So if we can move into the next slide. In today's agenda, we are going to step you through a description of combating social isolation. We're going to explore a no wrong door social connection and hear a path that Audrey takes in order to find social engagement. We're also going to hear from 211 Virginia and United Way about their resource databases and work with us. And then we're going to share with you replicability of our model and how your state or area or organization consider being a part of this important work. Next slide, please. So to kick off today's conversation with you in session, I'd like to go ahead and hand the presentation over to Catherine McDonald with Virginia Commonwealth University. Catherine, thank you so much for your partnership in this work.
Thank you, Sarah, and thanks to the whole team here. I'm so glad to be here today just to ground a little bit of what we've been working on in the research. My name is Catherine McDonald, and I'm from Virginia Commonwealth University's Department of Gerontology and the Virginia Center on Aging. And Katie Clark from ACL just gave a really strong overview of what the research has been showing us. We've been learning more and more about how social connectedness is a powerful protective health practice. If you could go to the next slide, please. A little more information here. Numerous studies have shown social isolation can have a worse impact on our health when compared to well-established negative health impacts, such as things like air pollution, smoking cigarettes, drinking a high volume of alcohol every day. We know that lack of social connection negatively influences health. It's highly associated with cardiovascular disease, fall risk, et cetera, and so on. Researchers have also been establishing key links between social connection and other social determinants of health, in particular housing stability, which I'll talk a little bit more about just to show some of the more recent research we're seeing with our service providers here in No Wrong Doors service area. On the next slide, please, I want to share this helpful framework. In case this is the first time you're seeing this, we know that for older adults and for all of us at all of our ages, social connectedness is a key protective buffer against these negative health outcomes. So I just wanted to take a quick moment to lay out, what do we mean by social connection? What do we mean when we say this? And to do this, I want to reference Dr. Julian Holt-Lundstadt's social connection framework here. Dr. Holt-Lundstadt is a pioneering scientist in this field, and she provides a really helpful framework with her typology of social connection. Looking at the 3 dimensions of social connection, we see structural, functional, and quality. Structural supports represent these objective measures and status that relate to our relationships, such as marital status, whether we live with people or we live alone, this kind of thing. Functional supports are all about the individual experience and perception, whereas quality supports have to do with how our positive relationships are these important buffers. We're affected by the positive quality of a relationship, just like we're affected by the negative quality of a relationship. This is the kind of part of a relationship that gets us through losses. If we're experiencing negative things in our life or difficulties in our relationships, it's going to introduce a lot more challenges for us. Next slide. In general, we see the ways these 3 dimensions of social connections benefit us every day. Here are some more tangible examples. For example, when we think about access, maybe this is access to having somebody who will give you a ride to pick up a prescription or drive us to a doctor's appointment, help us access housing if we're trying to fill out an application to rent an apartment. Encouragement, positive reinforcement when we need it and even when we don't know we need it. This keeps us going. Buffering, that protection, that relief from stress. Stress is toxic, and our positive relationships, our social supports are this buffer for us. We also should consider peer health behaviors. The people that we surround ourselves with influence our nutrition, our activity levels, a lot of measures of self-care. Advocacy. When people care about us, when they know us, they intervene, they help us navigate systems, they represent our best interests. Accountability, like positive peer pressure to follow up, to monitor, whether it relates to housing, for example, with paying our rent, getting those resources and those benefits that help us stay on top of our bills. And personalized information, customized ideas, connections, and resources about our lives and our situations on demand. When you can call somebody up or text somebody, or you know someone's coming over to chat, you can have these experiences, all these tangible, real-life examples of how positive social supports work to improve our health and well-being. Next slide, we'll talk about one area where researchers are seeing the impact of a lack of social connection, and this is in the realm of housing stability. This is a growing issue, including here locally in the Richmond region. Long-term supports and service providers, the folks who use No Wrong Door every day, have found themselves becoming more and more familiar with the consequences of economic insecurity, long-time wealth exclusion, when combined with lack of social connection. When we're lacking those 3 dimensions, we're seeing consequences within outcomes related to housing instability among the clients who are in the latter part of their life. We are seeing rising homelessness among older adults. And now, in later life, many are experiencing homelessness for the first time. So gerontologists and service providers are spending a lot of time looking at this trend, trying to find answers and interventions. What we have been seeing, researchers have noted the important link between older adults experiencing homelessness, whether it be for the first time, whether over a period of years, the connection between that experience and social connection or lack thereof. So that's why here in the Richmond region, VCU gerontologists and our homelessness services agency called Homeward selected and administered the De Jong loneliness scale among older adults during an annual point-in-time count. They found that the majority lacked social supports by several measures and dimensions in a way that looks different from how other ages experience this. So globally, gerontologists have sought to identify the pathways to experiencing homelessness for the first time late in life, and they have found these dimensions of social connection play a key role. Next slide. So it's thanks to important work like this, there's been this push for awareness of our need to be thinking more about social systems, about inclusion as a key social determinant of health in order to prevent more older adults from experiencing a number of negative outcomes, such as housing instability, for one. The Social Health Connector tool from No Wrong Door was developed with this in mind. The tool emphasizes all three dimensions of social connection, plus this whole concept of interdependence, the fact that we all need one another to survive. This tool can help us promote that notion and achieve better outcomes for all of us. So thank you for letting me share a little bit of the research background here, and I'm so excited to pass the microphone back to Sarah Link.
Thank you so much, Catherine. And I am so thrilled to be joined by my colleague, Erica Consti, as we step through the next portion of our session today. Next slide, please. As a state agency and state unit on aging, we understand the importance of navigating access to resources and supports and just how daunting it can be. Key to our work is having a place to start our own journeys, and with the framework of health and well-being and those social determinants in mind. Next slide, please. As a statewide No Wrong Door initiative under the Administration for Community Living and in their partnership with federal agencies that include the Centers for Medicare and Medicaid Services and the U.S. Department of Veterans Affairs, our premise is to improve access to long-term services and supports across all populations and payers and coordinate within a state to improve individual choice, including social connectedness and opportunities for quality and meaningful engagement. In Virginia, we adhere to the ACL's vision and framework for No Wrong Door being a coordinated, person-centered system and initiative with each of our 25 area agencies on aging as partners, serving as local leads and the first point of contact with local partner organizations to help streamline services and supports for individuals within their specific regions. There is literally no wrong door to accessing quality activities, services, and programs for social health, which is why we partner to build a customized tool that engages a person in a reflective, virtual conversation about the benefits of social connections to support good health and quality of life. Next slide, please. Partners in our continued journey to implement and scale our tool have included, you heard from VCU's Catherine McDonald about the applied research lens, the usability and testing that they've done with us, the question validation and community-based interventions with their support, with 211, with a robust resource database of 18,000 plus listings in Virginia, and a 24/7 chat feature available in both English and Spanish, as well as their dedicated toll-free number available 24/7 in over 200 plus languages. And with United Way Worldwide, our partner in winning this national competition with their national data platform. Next slide. But to hear more about our solution, I'd really like to share with you a video from Virginia's First Lady, Suzanne Yunkin, describing the importance of social connections at our most recent public launch event here in Virginia.
This is First Lady of Virginia, Suzanne Yunkin. No Wrong Door Virginia is an incredibly special network serving our Commonwealth. Your commitment to supporting older adults, caregivers, individuals with disabilities, veterans, and their families is critically important. As the mother of 4 children and someone who is deeply committed to caring for a nuclear and extended family, I know the challenges that come with ensuring all of our loved ones feel supported and cared for. That's why this person-centered virtual assessment created to design customized social health plans is not only innovative, but deeply necessary. As our world continues to fight against the growing threat of social isolation, we must work together to foster support and encourage the well-being of others. That is exactly what the Social Health Connector tool is doing. So again, thank you to every person who helped make this possible. This tool will certainly change lives for the better. May God bless you and No Wrong Door, Virginia.
So to step you through the Social Health Connector, I'd like to go ahead and introduce you to Audrey. Audrey is an 18-year-old woman with a developmental disability. She's single, has no children, and is a high school graduate. Next slide, please. Audrey says she wants to meet more people. She wants to live independently, and she wants a job. She thinks, where do I start? Am I eligible for services? Are there resources to help me pay for this? She feels lonely, bored, and isolated, and dismissed when no one has what she wants. She does use her existing connections to try to find services and has had to fit in with what she knows is available and is not always getting the customized solution she needs to meet her goals. Next slide, please. Audrey has two paths to help support her in her journey through No Wrong Door. Audrey has one, which is a supported path, and utilizing a person-centered options counseling through her Center for Independent Living, and for what she is sharing and for what we are sharing with you today of a self-directed path in which Audrey uses Virginia Easy Access to find information and resources to help her achieve her goals. Next slide, please. At the suggestion of a friend, Audrey arrived on the Virginia Easy Access website to start her journey for accessing the Social Health Connector. She then clicks on the Start Your Journey button. Next slide, please. And so here's how it works. Audrey responds to 4-part questionnaires in the domains of knowing she's not alone, sharing activities she enjoys doing, learning more about her connections, and by providing her unique demographic profile. She is then done. So to go ahead and share more about this exciting tool, I'm going to go ahead and hand the presentation over to my colleague, Ms. Erica Okonski, who's going to step you through the tool in more detail about the machine learning. Thank you so much, Erica.
Thank you, Sarah. I hope everybody can hear me well. And you can move on to the next slide, please. So I am going to step us through this journey with Audrey. Our very first set of questions within our questionnaire focuses on the things that Audrey enjoys doing. And also just wanted to note that the images that we created along with the Social Health Connector on each of the page as you step through it was very intentional. That design is to invite calm reflection as the individual answers and responds to the various questions. So depending on how Audrey responds to certain questions, she may also receive a follow-up prompt. For example, if she responds with a yes to the question, are there things that keep you from doing the activities that you enjoy? The follow-up question will be asked for her to describe those details. Notice one of the questions asks, what are some new things that you like to start doing? This is an example of where Audrey can provide a longer answer. She answers that she would like to learn how to play the guitar. Next slide, please. The next set of questions asks Audrey about her relationships and the supports received from people around her, leaning into the quality of her social connections. Also to think about big life events that happened in the last year. The image used here contrasts how sometimes we can enjoy alone time with other times when we enjoy the company of friends or family as we do an activity together. As an example of multiple choice type question, where Audrey can select one or more answers and consider the question, do any of the following make it harder to socialize with others? Options here would include things like hearing, vision, physical mobility, transportation access, and processing and reasoning. Hearing these options, you can understand how they translate to services and resources in the community. From this section of the tool, we also have the opportunity to quickly close out of it if the respondent indicates they do not feel safe in their closest relationships. Next slide, please. The customized plan generated by the tool presents as a PDF document that Audrey can print, and she can also save it into her profile on the Easy Access site. She can come back to that plan in the future and consult the recommendations or compare it to a new plan after stepping through the Social Health Connector tool again. The plan presented to Audrey consists of the following 4 sections. What is social connection and why it matters? So basically recapping the benefits. What are my unique considerations? The third one, where can I find help near me? And this is where the recommended services specific to her gets listed. And the 4th section, where can I go for further information, which highlights additional supports. On the next slide, I'll go into some of the details of that second page of this Social Health Connection Plan. So our research partners helped us think through how the plan is structured and the specific language used on the plan in order to normalize mental health and well-being. So Audrey's responses that fall into protective factors are highlighted under the heading of supporting well-being. While at the other end of the spectrum, we have our risk factors, but on this plan, those are talked about as handle with care. The remaining factors, those things still needing some consideration, are discovered in the for consideration middle section. A good example is when a person, similar to how Audrey responded, indicate that they live alone. While living alone does not necessarily mean you are lonely, it may lead to isolation if you do not have social connections outside of the home. Next slide, please. On this third page, or the third section of our plan, this is where the recommended services are presented to Audrey, and they are presented based on the underlying model that uses algorithms and tools like topic modeling, keyword extraction, ranked scoring, and pulled in via the integration with the national data platform fed by 211 Virginia's data and other 211s across the nation. Each of the recommended services show a percentage that indicate a confidence score of how well this service, its description and its keywords match to those extracted from Audrey's responses. We supply the address, the phone number, and the website URL for each of these recommended services. Next slide, please. On the last page of the Social Connection Plan, Audrey finds further reading, links to helpful tips and resources that could apply to anyone that steps through the Social Health Connector. Things like tips for staying socially connected. The My Social Connection Plan can be saved to the profile on Easy Access, as I mentioned earlier, making it easy to review your plan and its recommendations again at a later time. You can retake it. You can save all the plans you wish. The whole idea around the broader utility of the Easy Access website is to help Virginians connect with the services that can improve their quality of life. Next slide, please. Through her journey utilizing the Social Health Connector tool, supporting her with recommendations, Audrey can connect with services like the Independent Living Skills and Training and the Workforce Development classes. And she's encouraged to join a music program, all contributing to her connectedness and in line with her goals for herself. Next slide, please. Broken down very simply, the way the Social Connector works, as you've seen through Audrey's journey, is that the person steps through the questionnaire that is designed to allow for reflection about her social connections as step 1. And after that, the natural language processing enables the system to derive linguistic annotations from her text responses. Topic modeling, which I will talk about a little bit in the next slide, along with algorithms that drive relevancy and proximity rankings, all contribute to the final product. And if you can click on the last, just a click, you'll see our final sprinkle of no wrong door magic, ultimately arriving at that personalized plan that's generated for the person on their journey to better connectedness. On the next slide, we go behind the scenes a little bit more in depth. So let's take a look at an example of a free-form response and how it is analyzed. When the respondent types, for example, "I need hearing aids," the model takes the sentence and breaks it down to keywords. And as you can see from the green boxes here, it extracts hear and aid in a process of lemmatization. Values from the more structured multiple choice type responses, in this example, the value hearing that was selected in the drop-down list is taken and in combination with the first set of extracted keywords evaluated against groupings of topics that the model built from mining the resource side. In short, this topic modeling process involves finding common associations between different services and grouping them. During that evaluation, it considers the name of the service, the organization's name, the description of the service, as well as the taxonomy levels. Then statistical algorithms are used to do the linkage to the appropriate services. In this case, to group 2, which is all about hearing. The last step looks at the proximity of the services to the zip code of the respondent, and along with the relevancy score of each service, determines the ranking in the final recommendation. Next slide, please. So we officially launched this tool in March, and here are some numbers that may be of interest to you. I think I saw a question earlier asking about the age range of respondents. So of current respondents, 47% of them are under the age of 60, while 53% are 60 and above. And you can see those under 40, actually within their 40s are 40%. And then we've just, for interest's sake, added those respondents in their 70s, which are 15%. 50% of respondents indicated that they live alone. 44% live with others, and 6% chose not to answer. The majority of the people who used the social health connector took it for themselves. So you see 57%. And the next category was people taking it in support of a family member, or 18%. So like a young child growing and learning, this social health connector model learns over time. And the more people step through the questionnaire, the better the opportunities exist for improving its accuracy. Some of that happens automatically, and other parts are dependent on data analysis, followed by adjustments to the governing model. On the next slide, I just wanted to point out some of the keywords that got frequently mentioned. So in looking at the keywords that bubble to the top, we're seeing things mentioned frequently on the risk side that include worrying, feeling alone, drinking too much, watching too much TV. And then on the protective side of the spectrum, words and phrases include watching. So that would be watching birds, movies, or looking at nature, reading, visiting, and exercising. I'm going to hand it back to Sarah on the next slide to speak about some of the lessons learned.
Thanks, Erica. We've learned many lessons from our work in this space. I'm going to go highlight a few of them. One of the first is that the quality of the data really matters, and recommendations generated by services are only as good as the underlying data that supports it. In this case, Erica has stepped us through the process of the algorithms and using United Way Worldwide's national data platform and 211's resource database. So it's very important to have consistent and complete information provided under each of the data points. Also, having a really strong test cohort is essential. Making sure that local partners, self-advocates are all a part of this build and testing of the tool. And by building an adequate time for iterative testing and phasing of the work. That is also a critical component to make sure that it is well derived and developed. Also, outreach and marketing has to be timed. Before marketing and outreach can commence, you have to ensure that proper functioning of the tool is happening. Another critical area is governance of the tool, which is paramount. You have to have strong privacy and other security measures in place. And in Virginia, we adhere to our state standards for information privacy, which is critical to making sure that people's data is being maintained and secure. And finally, having an efficient and flexible interface are critical to your success. This is why our partnership with 211 and United Way Worldwide and their seamless integration to the back end of our solution has really mattered to us in making sure that this tool is available. So with that, I'm now going to hand it over to Kathy Spangler, the director of 211 Virginia, so that she could step us through her slides. Thank you. Thank you, Kathy. Thank you for your partnership.
Good afternoon, everyone, and thank you, Sarah and Erica, for the partnership. We're so excited at 211 Virginia to be part of this inaugural Social Health Connector Tool project, and grateful for the prize that was awarded by ACL to make this a reality. We are learning as we go. I'm the director of 211 Virginia. I'm located at the Virginia Department of Social Services. And we're one of 3 211s that are statewide, which is somewhat unique. Most states, all states have 211, and it's the 3-digit call center hotline access point through text, web, and chat that provides information to people in need, right? And the database that we said, Sarah mentioned it, is about 18,000 records all across the Commonwealth. It's the largest human services resource directory in the state. And so it's really a critical resource. And heretofore, 211 Virginia has provided its services direct to the constituents and people living in Virginia. And we have had a pre-existing relationship with DAR's No Wrong Door. So it really became pretty easy to imagine extending our partnership to begin to imagine and think about this project. And so 211 Virginia, the way we see this, it's a unique opportunity for us to extend the quality of the information that we have through a new portal, another No Wrong Door, if you will, to provide the public with information. Since this project, we've actually expanded our reach and partnerships to our data, to our 988 crisis hotline as well. So we still provide the basic services to the public on a 24/7, 365 basis. We still continue to curate a database that is nationally accredited for providing information and referrals. But we're finding new and exciting ways to partner across government, in this case, to bring those resources to more individuals in need. I think what's unique about this project is its feedback loop. So we think we have a really comprehensive 211 resource directory, but by the utilization of the Social Connector tool, we're learning where there are gaps, not only geographically, but by topic areas in terms of social health, and social connection. So it really is a partnership that is a feedback loop to not only leverage the existing resources that are in 211 Virginia to make those available through yet another portal, the Social Health Connector tool, but it's also a feedback loop to us to help hone and focus and expand the capacity of this resource directory for its utilization in service to the public. So all due credit to DARS, No Wrong Door, for their innovation, their vision, and certainly to United Way Worldwide for their national view of how 211s can be not only a direct service provider at a level that is unmatched nationally and locally, but also be leveraged to support other partners. And so I'm going to turn it over to Mary Miller at United Way Worldwide to talk a little bit about the national data platform and how that really gave us the Ready Connect, the opportunity for 211 Virginia to seamlessly offer up its resource directory for this project. Mary?
Yeah, thank you so much, Kathy. Hello, everyone. I'm Mary Miller. I'm the Director of 211 Data Projects at United Way Worldwide, where I support the entire 211 network. United Way Worldwide was one of the co-winners of the Mental Health Innovation Challenge, and our role in the collaboration with No Wrong Door Virginia focused on building the infrastructure that would allow data sharing in a way that was replicable and interoperable. You can go to the next slide, please. So as Kathy described, 211 Virginia is just one of many 211 organizations. There are over 200 across the United States, and each has staff that curates local resource directories and builds relationships with local community-based organizations. And so we've recognized the value of these local connections and data curation, and we've noticed an increasing demand to connect resource directory data to inform tools like this one. To support data sharing, we built what we call the 211 National Data Platform. It brings together resource information from all of the different 211s, regardless of the software that they use. So the platform provides the infrastructure for data sharing through an API developer portal, which opens up the ability of 211s to partner with other organizations for a variety of projects. 211s vary in size and technical capacity, and so this kind of levels the playing field for 211s to share data for a variety of uses. Next slide, please. At a national level, the National Data Platform brings together more than 1.6 million resources from across the country. I like to describe the platform like plumbing. So 211 data is the water, and we've built the pipes that take the data from local 211s to a national directory, and then allow that data to flow to partner organizations and projects and tools like this one. One of our grounding concepts and values when building the NDP was ensuring it was interoperable, which means other states or local initiatives can partner with their local 211, benefiting from local knowledge and resources, and feed data into other tools. Because 211 resources are built on a rich taxonomy with resources for basic needs, healthcare, education, tools like this one can be adapted for other partnerships or use cases. Next slide, please. I've included this slide as a takeaway, as it includes a bit of an overview of what is 211, in case you're not familiar. And so if you're interested in bringing a project like this to your community, whether that's statewide, whether it's in your city, county, I'd encourage you to connect with your local 211. Connecting people to resources is the heart of what we do at 211. We recognize the importance of facilitating these social connections. It's been a real privilege to work with experts in this space and leverage technology together. And I'm so excited and hope this is the first of many projects like this one across the country. Thank you.
Thank you all for such a wonderful presentation and overview of this tool. I, again, am just so proud to have seen your journey in the development of this, and appreciate you all sharing with us today. Would you all share a little bit more about how a consumer accesses this portal? Does a staff member or service provider fill it out on behalf of a consumer, of an older adult, a person with a disability? Or is it more self-serve, or someone might come upon the resource on their own and fill it out?
That's a great question. So anybody can fill out the tool from the Virginia Easy Access website. It's literally a start your journey button. And one of the first questions that it asks you is, are you filling the survey out on behalf of yourself, another individual, or caregiver? So again, you can fill it out yourself for yourself or on behalf of somebody else. And you can also create a profile to save it. Just want to emphasize that the results are only specific to Virginia. And I think as both Kathy and Mary Miller have indicated too, that there's really some exciting opportunities for other states to consider this and the results being specific to their state.
Wonderful. And I so appreciated hearing about 211 and how other states or local partners could use their 211 partner and use that data, those resources. Could someone from the No Wrong Door team, or maybe with the tech background, share a little bit about how you used 211 and process the survey results to then generate that personalized social health connector plan?
Sure. So it's always a process, an iteration process. So I would say, kind of just going back to lessons learned, and if others consider to replicate this, is to make sure that you have all of those database structures in place so that you can do various queries. What we've learned is we had to query against the names, the descriptions, the taxonomy of the resource database in order to best build a linkage to the correct resource. So lucky for us, with the great work that both 211 Virginia has done in just structuring their database and then interfacing with the NDP, which allowed us to have those, let's say, interfaces or queries available to us in multiple formats. So you can query against multiple fields, or you can query against one field. That really made a big difference for us in order to pull back the right resources. And so both kind of in a transaction by transaction way to query against the database, and also in more of a bulk way as we built those topic models that I discussed earlier. So I guess in summary, I would just say having multiple avenues to query the resource database is a game changer.
There's a lot of interest in the chat about replicating this model, thinking about maybe scaling it to a national, national platform that everyone could use. A lot of states are interested in this. What are some first steps that you would suggest for those interested in replicating this or maybe scaling it? And would love to hear from everyone, as you all have kind of unique perspectives in this project.
Can I give one bit of insight? I would say there's a lot of components to the project, right? But I think at its heart, the approach with being strengths-based and a message in the results page for every user that feels uplifting and empowering and positive, and just being mindful of language in that way, that's always got to be a key part of anything like this. That's my tip from the human side.
I think one of the things that I think will happen, and maybe it has to some extent, and maybe Mary and Erica can talk a little bit about it, but technology is moving so quickly that the influence of AI may accelerate the scaling opportunities here. Not sure, but the machine learning is really the value of the iterative knowledge base that will be developed for the database over time. But I think there are some innovations on the horizon using AI that could really accelerate the scaling of this, and even on some extent the replication. So I thought maybe Eric or Mary would have some insights there.
I can say we've heard a lot about chatbots and just natural language models, like processing. So how do we parse like what someone means when they ask a question, or how can we use that to kind of feed the suggestions? And I think one of the strengths of 211s across country is they're built on a really rich taxonomy. So there are layers and layers of how we categorize resources. So everything from just food resources, but it'll go into like meal delivery to a takeaway bagged meal at a grocery store. So like there are layers to it. So we're able to dig really deep in and like pinpoint resources to needs. And I think there's so much potential there. Yeah, as we get AI, rather than a person having to comb through it, we can dig through much quicker and find the resource that really gets to the root of the person's need. Yeah.
Yeah, I would just add to what Mary said is, we speak about the model learning. It needs to pick up a little bit better on nuances and the intent. Sometimes when people speak in different ways, I might answer a question different from you. And so that's where I think it's going to improve as technology improves and we can teach it a little bit better to understand nuances.
I think there's also that benefit of the backstop of a real person. So you can call 211 Virginia 24/7. It's like, if this isn't working, or if, especially in the topic of connection, you want to talk to a real person and hear their voice and feel seen and recognized, then I think it's a good partnership in that way.
And I think I'd just add to that, assembling the right team of partners. This isn't a one-off. All of us have been working collaboratively in this space, and this isn't something that is a sprint. It's been a marathon. It's been years in the making, and it's been persistence and dedication and commitment. And I think all of us here at this table today are very much passionate about this work. It takes heart.
Yeah, I so appreciate that point, Sarah. I think we accomplish our best when we work collaboratively. What are some tips that you can share with attendees on how to begin those partnerships, seek out those partnerships? Where do we look? Who can we partner with? Where have you found success in partnership? And would love to hear from you. I know you've been along for the ride for some time with this project, but really from anyone.
I'm just going to say really quickly, a university partnership is so critical. I think Catherine said it most about language. There's a lot of othering that happens in the space of aging and disability services. And we're all in this business of growing older. We're also all in this business of having a different type of ability. And so we all need to understand that this isn't for just somebody else. This is for us, for ourselves, and for our families. So I think having the right language and the right, evidence-based model and research behind it is critical.
Yeah, and Catherine, you mentioned this in your comment earlier, and I think it's worth kind of revisiting. It goes along with Sarah's point. That, the work that we do when it's consumer facing, we really need to make sure it's person centered, it's positive. I think even at ACL, we think so much about, focusing on the positive impacts of social connection rather than, leading with social isolation and loneliness and those negative impacts with health. What are some of the concrete ways that you've done that in this project? Maybe some examples of framing or words, images that you've used. I love the platform and how user-friendly it is.
I think Erica pointed out the handle with care and the different ways of using language around risk factors. That's a great example. So Erica can talk more specifically about that. But in the realm of being person-centered, thinking about access as well, me and Erica spent a lot of time running everything through a reading level and an analysis. And so it's crafting the language so carefully with all that in mind: access, strengths-based, positive mindset. Specifically, I think that example Erica gave before about handle with care. I think there were a few more examples, right, Erica?
Yeah, that I think is our strongest one, where we decided, instead of saying risk, the supporting well-being, it just comes, with warmth, if you think of those words. And then I think I saw a question earlier about if I understood it correctly, if we built this separate, if it was something we took off the shelf, is kind of my take on the question, and just embedded into easy access. But really what happened is we knew that we need a space for all of the tools and features we want to bring to Virginians in a self-directed path to be person-centered and to use language that's easily understood or easily that you can consume it easily. So as Catherine mentioned, even not just even the social health connector, but other tools on the easy access website or just the way we speak, we've really, we try to keep the language at a level that is just easily consumable and people can easily understand it. So that framework existed, and then we brought the social health connector into it, making sure that it adheres to those standards. So it's always a challenge to try and say things as simple and most understandable as you can. And so we went through a lot of conversations around the questions, but luckily we had the VCU team to just help us with that part.
That's when wordsmithing becomes fun.
Absolutely. Yeah, I really appreciate those examples. I think that's really helpful advice we can all take home with us. I'd love to know a little bit about the results, the findings so far with people's experience in using this tool. We got a question in the chat on what are some of the most common needs among users that you're finding, or maybe initial takeaways around these barriers to social connection that you're finding through the early use of this tool.
I'd love for 211 to speak about this because I'm sure they hear about it from multiple about these needs. But it's your usual suspects in the space. It's the housing, it's the transportation. It's a lot of those core social determinants of health are just around basic access and need.
Yeah, you nailed it, Sarah. It's housing, it's food, it's transportation, it's utilities. Those are always in the top tier of inquiries to 211. But as we know, people don't just have one issue that they need assistance with. And so it's through this tool, but it's also through the connection and the people working in 211s across the country that help navigate the resource directory and discuss with the caller or the person contacting us, how they're doing, what their needs are. And so it's always more complex than just one thing. And so we've made sure that, and again, social connection means much more than those really high need things. It's the recreation resources, it's the social opportunities. And so that's the beauty of 211, and it's not replicated anywhere in the country, is that we have that broadest sense of social determinants of health is what our resource directories represent, is that it does have those social resources, but then it also deals with some of these more prevailing challenges that people in need have. So that's the beauty of it. It provides that full range of social determinant of health options and resources to tap into when people reach through, whether it's this tool or a direct contact to 211, that they have access to that broadest sense of resource needs.
Maybe I can just add from, as we move forward with this tool, we're going to do a little bit more analyzing of the data, especially those free-form responses that we get. We have to dig into them with a little bit more of a sophisticated analysis tool to read through and understand the trends. But oftentimes we see, like I've mentioned on that one slide, people there's a few things that gets highlighted. They either watch too much TV or they isolate themselves by being just in their home. But on the positive side, we see a lot of wanting to be in nature, wanting to garden, wanting to cook, a lot of wanting to learn things. So we will analyze more of those free form responses. It just takes a little longer to dig into them.
And I would say, for the sake of almost 400 people on the call, which is so wonderful to have so many people with us, that if you don't have your programs and services listed in 211s in your area, please consider it, because the better the data resource directory is included there, the better a tool like this is going to serve the public. And whether it's through a tool like this or just in general, people in need contacting 211 would really just put a plug in for whatever the spectrum of services you provide under that umbrella of social determinants of health. Please consider working with your 211s to get those programs listed so that they can be referred regularly to your constituents.
And I'm going to put a plug out there too, because a lot of people don't know what person-centered options counseling is or what a AAA, an area agency on aging, is. And those are critical in regions to helping people get those services. So I think, again, going back to the collaborative partnership of knowing what's out there and what exists, there's so many things that are right here in our own backyards that we don't know about, which is one of the great things about the tool. But Erica and I were brainstorming even prior to this call about, within some of these spaces, you have programs and services, but even having like an event that somebody could go to, we were thinking, how amazing would that be to build into the tool of partnering with your Office of Tourism when an event is happening? So a lot of times people, just having a one-off event is really one of those opportunities for them to feel more connected in their communities.
And I think I'd also sort of challenge all of us. I live in a rural space, and I've constantly encouraged our 211 contractor to make sure that we have listings and programs in rural spaces as well. And so it's a bit of a gap. I don't know nationally, Mary, if that's prevalent, but we need to make sure that when people use this resource or reach out for information and referrals, that we've got a good coverage across our geographic areas, including rural spaces.
Can I piggyback too on Kathy's response to rural areas? Because we have an amazing partnership at the state with our assistive technology partner, VATS, Virginia Assistive Technology. They have their own database. That's something that we would like internally. So if somebody is coming and searching the tool, they can learn about some of the things that a lot of people might not have on their radar to help really think about isolation. One of them that many of us might know about are these robotic pets, a joy for all. It's amazing how these robotic pets, it's not the same as social connectedness in terms of human connection, but it does provide an outlet for people who are going through some of this, and especially for anxiety. And, that type of partnership where somebody could get a tool available to them that they could just purchase even off of Amazon, it would be very helpful in this space to us.
Yeah, wonderful. Something that we've kind of touched on a little bit in a few of these responses is outreach. How do we really connect with folks that need the services, the supports, the opportunities, even for recreation the most? Kathy mentioned rural populations. I think that will always be a challenge, and oftentimes in a lot of our work, the people that are showing up, to every single program are the ones that maybe are not at risk or really, really struggling. Would love to hear kind of about that point of outreach. How are you sharing this tool? How are you thinking about making sure folks really know about this tool and can access it, who maybe are more of a priority population, who aren't the ones that are showing up to bingo night or community spaces consistently already?
I feel like I'm doing a lot of talking, and I know everybody has something to say. So, prior to coming to Virginia, I worked in New York City, and I always saw an amazing partnership that they had with the U.S. Postal Service. I think that that's, one way we could get like flyers out to people in areas that may go untouched. Even just having a warm line, those types of things of just having a friendly visitor call in, whether it's a neighbor, those types of things. But I think we're trying to get creative in this space of thinking about going more into like churches and other places that with the faith community. And so again, really thinking about some collaborative outlets of where people might go and they don't know about some of these additional resources. We have a new partnership right now with some of the tribes here in Virginia. And I think that's one really great partnership for us to kind of share more resources as they exist here in Virginia. Catherine, I know you've done a lot of work in this space. Maybe you could share a little bit more.
Absolutely. I mean, a lot of the power of No Wrong Door is in our users and partners. And I think about all the hard work done at AAA's to reach as many people as possible. The people who work in this field are so passionate about finding folks who can be hard to reach, right? And I know that drives a lot of the outreach and engagement for all No Wrong Door programming and all AAA programming and beyond, and all the different partners who use the system. For example, I mean, here at the Center on Aging, we have a program that we work with. This is a program that's found in lots of places. We have like one franchise here called Alter, which goes into churches. And so we do a lot of partnership with them to reach folks who maybe don't love to use, they don't use a computer every day, you know, but when they hear about something good, they're going to use it. And so that's one way we do outreach there. It looks different depending on who you're talking to. And it's about keeping in mind that person-centered lens that we all use technology, we all use communications in different ways. We all have our own preferences. And the best thing, one of the best things about SOHECO is that it is tailored for different types of preferences when it comes to that.
And say I agree. I think the strength is in our partnerships a lot, because to say No Wrong Door, like you can reach it through all of our different agencies and all of our different ways to connect with people. And I think the collaborative nature of a partnership like this, like there are so many people that need assistance and need help and need connecting, that we're not in competition with one another. We're all trying to bring people to the same resources, to the best connection for their needs. And so we all bring our strengths in different marketing or connecting to our local communities. Yeah.
So we have around 5 minutes left, and I am going to ask each of you to share one final thought or thing that you would like to leave with everyone at this National Summit to increase social connections. What is one thing that you would like to share with all of us that maybe you haven't had a chance to share yet? It could be an anecdote or a learning, or maybe even just a suggestion for us all. And Sarah, I will start with you, but would love to hear from everyone. So everyone get ready. Go ahead, Sarah.
Yeah, I think just knowing that we're all in this space of isolation and loneliness, we probably have all experienced it at some point in our lives. And just knowing that a small thing can make a big difference and big impact in somebody's life. And this is just one tool, but we all have the power to make that change.
I'll go next, and given kind of like the technology role fell to me a little bit, I'll just say don't be afraid to use technology even for a very human problem or issue at hand. This journey definitely took us down unexpected paths. Sure, we relied a lot on the technology, but you know, in the end, it boils down to just love each other. Show the love through the work that you do. We try to do it through the language. We try to do it through imagery. Even our little red cardinal that shows up on all the images that we use hopefully portrays resilience. But yeah, don't be afraid. Try it and go through iterations, because that's where we finally hit the magic. You know, try again.
I can jump in next. I mean, it's kind of similar to what Sarah and Erica just said, but what I would want to say is that every time we're interacting with a client, a patient, a student, whoever it is that we talk to and touch in any way, that's a chance for a positive social interaction and a positive moment and a chance to change someone's day or week even, including when we're designing tools for the computer, you know, thinking about the language that we use, like we keep going back to. It's an opportunity for a warm, loving connection.
I would say, those of us who work in the human services field, it's sometimes a blind spot to think technology would replace that human-centered connection that we make. And I think it's the 21st century. And projects like this are showing us that you can have high tech and high touch. And really that's who we are, but we need the high tech tools to be able to scale, expand, empower the connections that we want to make. So I think it's time for us to embrace the high tech, high touch reality of this human service delivery capacity that we have. And just really want to reflect and thank everybody at DARS and United Way Worldwide and ACL for imagining how technology could reinforce our human-centered design and the connections that we make with people. So thank you.
I love that, Kathy. I was going to say, I think we all were worried when like Google came out and you could search for things. And we said, well, we used to use paper-based resource directories and we would look on it and say, okay, here's this food bank or whatnot. And like Google's going to replace all our jobs. And it didn't, because people still want to connect. They still need that expertise of information and referral. And so I think this emerging technologies are just more ways that we can build our capacity or do our jobs better and help people better. So say we should keep digging in and connecting with one another and collaborating around it, because we can help more people that way.
Wow, thank you all so much for sharing about this social health connector tool. Our hope is that other local, state, and national partners have learned so much from you and will continue to learn and replicate this model to better connect consumers to relevant services and programs that address their social health related needs. I just have loved seeing this journey that you all have been on and being a part of it, and have so much gratitude for the work that you're doing to promote social connection and health and well-being. So thank you so much. We will now have a very brief 15-minute break before we continue with today's summit. So please enjoy the time to, grab water, a snack, maybe catch up on emails, and we will promptly return at around 2:30 with a session on the future of virtual programming. So thank you again for joining us in the first part of today's session, and we will see you soon at 2:30.
Okay, welcome back, everybody. I hope you got a little bit of a stretch break. During our next section of the agenda, we will hear from a panel of speakers on the future of virtual programming as we enter or are in a post-pandemic era. So first, we will hear from Alex Glazebrook, Vice President of Programs with Senior Planet and Older Adults Technology Services, OATS, from AARP. Alex will start with an overview on this topic and also then introduce our panelists. And then the panelists will be showcasing a variety of replicable virtual programming models to serve as an inspiration for your virtual programming work. So Alex, I will pass it to you. Thank you for being with us today.
Thanks, Meredith. Thanks for having me. And yeah, it's great to be here with you all on what I think is a very important and timely topic. As Meredith mentioned, I am Alex Glazebrook, the Vice President of Program Operations at OATS, Older Adults Technology Services, affectionately known as Senior Planet. So I'm going to do a really brief introduction of our work, so then we can pass it over to this very distinguished panel, who I think you'll probably all want to hear from more than me. So with that, I'm going to just quickly overview OATS and our approach to the programming that we've been doing both in person and virtually, which is really, I think, kind of the meat of this discussion. So those of you that are familiar with OATS, we've been around for about 20 years. Our programs began in person back in 2004, basically delivering tech training and other digital literacy offerings to people in the 5 boroughs of Manhattan, 5 boroughs of New York City, excuse me. And over the years, that work grew. We expanded nationally, and we had the fortunate chance of actually affiliating with AARP back in 2021. So we are now a charitable affiliate of AARP, which means that we're still an independent 501c3 nonprofit, but we have sort of all the shared power and reach that AARP brings behind the OATS and Senior Planet brands. And leading up into the pandemic, as I mentioned, all of our work was actually in person. That's since changed. As I think many of us are aware, serving people in person is not the best way to reach people, especially during a pandemic. So during that time, all of our programs migrated online, and we also developed an initiative to license our programs. So now older adults can participate in our programs in person at locations that we manage around the country, online and through our contact center. And then thirdly, through something we call Senior Planet licensing, which is an opportunity for community-based senior service providers to actually get our curriculum and IP and support for free. And then that work can be delivered in your local community with your staff and your team. So those are kind of the 3 main ways that OATS is serving older adults now. And, because this panel and this section of the summit is really about virtual programming, I just wanted to talk a little bit about how Senior Planet and OATS are approaching that. We've created something that we think is as barrier-free and friction-free as possible for people to participate in. And I think, for those of us who have been delivering virtual experiences and programs to older adults over, maybe it's just the last 4 years since COVID, or maybe before that, we know that there are a lot of hurdles in getting people online and getting them connected to virtual programs. So OATS has taken an approach with our Senior Planet programs that reduces registration requirements, creates a lot of offerings. We now are starting weekend classes and nighttime classes. And we have a lot of wraparound content that people can tap into when the programs aren't running, so they are able to stay connected. And then finally, we use our hotline and contact center to support people to get connected if they're really having difficulty getting into a program or really can't figure out that last little mile of technology that they need to get online. We'll help them through the contact center. And that's been really successful to help round out the virtual experience. And, I think keep or help include some of the most isolated older adults that we interact with. We have a very robust methodology. I won't go into the details of that now, but we try to take what older adults tell us, use our experience and approach, and build out programs that fit in with the unique qualities of older adults and specifically older learners, all with a view towards keeping people connected and socially engaged as they age. And there's one really powerful quote that I just wanted to mention before I pass it over to our panelists, and that is from a participant, Jolyn, that we had in a rural part of Texas during COVID, who said, "I trust Senior Planet completely. It's transformed my life. I live alone in a very small studio apartment in a very rural part of Central Texas. I don't have any family around. When I went into quarantine, my world felt smaller and smaller until I was almost feeling like I was starting to disappear. But my daughter, somehow or other, found out about Senior Planet, and Senior Planet gave me my world back." So I think we all know that virtual programming has that ability to reach people, especially people who might be the most disconnected. And I think that's why we brought this panel together, and it's a really exciting opportunity for people to share even more about the work they're doing and the resources that are available to help engage everyone that we collectively work with. So with that, I'm going to quickly introduce our panelists. We have a really great panel today, and I'm really excited for you to hear from everybody. So our first panelist, sorry, my internet is cutting out a little bit. I hope everyone can still hear me. Our first panelist is Lucas DeLuca, who is the Director of Support Services from the Amputee Coalition. After Lucas, we will have Joseph Rolandelli from the Opal Center in Baltimore's County Department of Aging, followed by Raina Sage, who's the co-director of the Research and Training Center on Disability in Rural Communities at the University of Montana. And last but not least, we'll have Rebecca Freeman, who's the Section Chief of Service Operations for the Division of Aging and Adult Services at the North Carolina Department of Health and Human Services. So that was a lot. And with that, I'm really excited to pass this over to Lucas, who's going to talk a little bit more about the work he's doing. Lucas?
Thanks, Alex. Super excited to hear what you're doing with OATS, so thank you so much. Hi, my name is Lucas DeLuca. Today I'm going to be talking about the Amputee Coalition's virtual programming. It's a big space, so we're going to talk through a few different items, but specifically focus in on one of our most exciting projects as of late, which is called Amputee Coalition Connect. So without further ado, we'll get underway here. So my name is Lucas DeLuca. I'm a bald man wearing glasses with a bushy beard. I am the Director of Support Services at the Amputee Coalition. I am an educator and an ADA coordinator. I'm also a right above knee amputee. I'm a congenital amputee, so I was born with limb difference, and I had my leg amputated when I was 1.5 years old. So been in the space for a long time on a personal level, been working with the AC for a little while now, and very excited to talk to you about our programming. If we could go to the next slide, please. So the Amputee Coalition started in 1986 as a collection of support group leaders. What's really exciting is those support group leaders saw a need for folks to represent themselves in a space and to have a conversation, and thus the Amputee Coalition was born. Our vision is a world where our community thrives with equity and inclusion, and our mission is to support, educate, and advocate for people impacted by limb loss and limb difference, fostering a culture of diversity, equity, and inclusion in all aspects of our work. So we're going to talk about a range of different programs today. And so what I want to start by doing before we jump kind of into the rabbit hole is to talk about our approach to digital virtual support services. And so because the Amputee Coalition has been around for a few years, to say the least, we've got a range of different programs that allow individuals to either receive support or to engage and volunteer in a time that best speaks to them. So many of you may be familiar with using feedback or assessment loops when fine-tuning programming. The Amputee Coalition, we've taken those elements and those approach, and we've applied it to kind of a continuous model for a digital support service ecosystem. And this, again, allows folks to show up whenever they're ready to in their life. We know disability can impact anybody at any point in their life. So recovery, community, and normalcy look different for everyone. And our focus is always to create multimodal approaches and accessible opportunities. So as we go through the programs today, and as you look here, you see individual support, community support, and systemic support. You'll notice that each of these can be divided into two separate areas. And those are people who are A, looking for support, or B, looking to volunteer and provide support. So we really think it's important to abide by the disability credo of nothing about us without us. So our first program and our oldest program is a certified peer visitor program. The real methodology here and the focus is to make sure that nobody has to go through their journey alone. And so we work through our 800 or so certified peer visitors, and we link them up with individuals with a similar level of limb loss and limb difference, and make sure that they have someone who can speak to, listen to, and understand their experiences that they're going through. This program, while offered in person, has thrived both over the phone and now virtually, and we're really excited to see those changes. It also identifies both the individual engagement piece by showing individuals who are volunteering to get involved to help others, but also supplying knowledge to those individuals who are looking for support. So we have a support group network. The Amputee Coalition liaises with over 300 support groups nationwide who support folks with limb loss and limb difference and their families and caregivers. And it's fair to say that of those 300, about a quarter of them provide digital or online support groups. And so we do our best to highlight, engage, and share the work that our community members are doing. There's no way that we can be in every corner of the United States at any one given time. So we work really, really hard to make sure that we're highlighting and providing space for those folks to show up. And as part of our support group network, we're always providing support group leaders with cutting edge resources, information, and education about the limb loss and limb difference community. So that brings us to virtual support groups. We just talked about it a little bit in regards to what our community is doing, and that tackles that community engagement piece. But the Amputee Coalition has, during the pandemic, noticed a huge decline, or when the pandemic was happening, a huge decline by over 100 different support groups closing. And so to help fill the vacuum, we began holding virtual support groups. Those support groups grew and evolved. And in so many ways, we're now hosting 6, actually, I think it might be 7 virtual support groups where we have over 450 community members registered. We're looking at different time zones all across the US, as well as a caregiver group, a young adult group, and a Black, Indigenous, and persons of color group. All of these serving the sole purpose of making sure that if, let's say there's not a virtual support group that someone feels connected to in their area, that there is a national resource that folks can go to, meet with individuals and discuss based on kind of a larger time zone or identity-based relationship. So the program that I'm most excited to talk to you about today, specifically in regards to virtual and digital programming, is our most recent release called AC Connect. And this is a space that I think can lovingly be described as a combination of a listserv, Facebook, and Reddit. And for those of you who have occupied all 3 spaces, that may seem intimidating, but I promise you it's a very exciting space, a very intuitive space that allows amputees and folks with limb loss and limb difference, even family members, to go online, to have a space to discuss with the community of their peers questions, concerns, where to get help, what resources may exist. And spaces like this do already exist. There are Facebooks, there are Reddits, there's Instagram. And as I said, there are virtual support groups. But what happens is the virtual support groups have a start and stop time. And Facebook while being a great resource, might not always be the safest space for individuals to show up and share a genuine version of themselves. And so we've worked really hard to create a space that is inclusive of folks with limb loss and limb difference, but also provides this really exciting sense of community and sharing of resources. And so I'll just share with AC Connect, the hope is that you can engage with other members, volunteers, even medical professionals and our AC staff to provide information, knowledge, and next steps. We have a really phenomenal patient navigator who's pretty active in this space. We provide feedback on critical issues impacting the limb loss and limb difference community. And the real focus here is always self-advocacy and helping folks to elevate their voice and grow their network to better advocate for themselves and policies that they care about long-term. And that's AC Connect in a nutshell. The bulk of the last 3 spaces have been that community engagement piece. How do you get involved? When you're involved, then how do you become a supporter for others by sharing information that you've experienced? Now let's talk about that systemic piece. You might never hear the word Amputee Coalition if you're on your individual journey, if you're going through a hospital system. You may not ever Google disability supports. And so what's important for us is making sure that hospital systems, clinicians, and other providers of care, healthcare throughout the US have access to Amputee Coalition resources digitally, and also a community of healthcare peers to discuss issues on how to best provide care. So that includes our healthcare partnership program. So this has been going on for probably close to 8 years. The goal is to grow a coalition of healthcare partners, hospitals, and clinicians to again discuss, share, and amplify the supports that the Amputee Coalition has so that nobody has to go looking for supports. Reducing that barrier to access is really important. And so in regards to this program and meeting virtually and providing newsletter and collaborating amongst peers, we're also really sending out and relying on them to utilize digital resources and also working with them to increase their standard practices of care, providing virtual peer support within their healthcare systems and beyond. So in many ways, our hope here is to make sure we're covering the full gamut from individual to community to systemic engagement. And the last piece of that systemic care is making sure that you don't have to be the Google expert. I want to share that for many of us who have looked for help or have said, hey, I need something more. It might not always be as easy as a Google search. And so in so many ways, we've created Community Connections, which is an online database with national, state, and local resources, everything from food security, all the way through to housing, all the way through to different prosthetic care facilities and hospitals and peer supports. And so in so many ways, we are trying to take the guesswork and the kind of expert nature out of Googling and providing folks the easiest pathway to the care that they most care about. And so we're constantly growing this space. It's constantly evolving. To say that it's a small database would be lying through my teeth. It's very large and continuously being added to. I don't want to go much over my time, so that makes up all of the AC programming. Again, thank you so much for listening to our model and then seeing all the work we do. Appreciate it. I'd like to pass it over to the wonderful Joey, who is the Opal Center Director. Thanks, Joey.
Thank you, Lucas. Good afternoon, everyone. As he said, my name is Joey Rolandelli. I'm the Opal Center Director with the Baltimore County Department of Aging. Next slide, please. So what is Opal? Opal is the 21st Senior Center for the Baltimore County Department of Aging umbrella. We follow the senior center model in that we provide programs for our senior citizens within the Baltimore County area, age 50 plus. OPAL stands for online programs for adult learning. Some people call it online platform for adult learning, but either way, it all stands for OPAL. And we utilize Zoom through My Senior Center, as well as Google Meets, other virtual conferencing sites. And like I said, as long as they have Zoom, meaning a computer, laptop, phone, they can utilize our resource. Next slide, please. We offer online classes. Now moving into a post-pandemic world, we are now partnering with our brick and mortar centers in which we can do hybrid, meaning that, for instance, there is a Tai Chi class happening at one of our centers. We can put a laptop in there and broadcast it to our other members at their homes. We can do evidence-based programming. We have even expanded into caregiver programs for those taking care of our senior citizen members. Next. So being a service dedicated entirely to providing online content for our members, our programming possibilities are virtually only limited by our imaginations and our budget. So while we are able to provide programs provided by local resources, much as our other centers do, we are able to go beyond the borders of Maryland and DC. We have partnered with the National Park Service in Arizona. We have done programs with the Mob Museum out in Las Vegas, who even knew such a museum existed. The National World War II Museum in New Orleans. Just coming up next week, we're going to partner with the Baltimore Ravens for a tour of the stadium. And similarly, our members are able to utilize OPAL from all over the world. A story from one of our members is that she went to visit her family in India for a month, and she was still able to attend Spanish classes every week using OPAL. Next slide, please. For those that are more interested in, say, the facts and figures, here we have some data from the last year. In 2023, we had a total of 379 users, which, going based off other statistics within the county, is about the same as one of our smaller brick and mortar centers. And based on the first quarter of this year, we are on track to at least match and probably beat those numbers from last year. In a recent satisfaction survey, 54% of our users said that they had positive or highly positive rate satisfaction, and the 44 gave us at least neutral. So not many negative reviews coming from our members, and 70% of those members gave us a high rate of use, in that they just click a link in their emails and they are in the program. Speaking of programs, our most popular programs are our physical activity programs and the creative arts programs, meaning that they are working out and drawing and painting from home with their fellow senior center members. Next slide, please. But don't take my word for it. Here's some of our testimonies from our members. We had one member, Alice, who said that she appreciates the ability to attend programs that would otherwise be out of reach to her while she's at her home. Marcia said that the OPAL Center has opened a new window for me to participate online, meet new people, and access information vital for my health and wellness. I do not have the story on here, but we another little anecdote from our members is that we had one member who was not coming to Tai Chi for a while, and the other members were able to reach out and say, hey, are you okay? and it turned out she was fine. But it just shows that the growing community of being able to reach out virtually. Next slide. So yeah, that was really quick. That was a quick synopsis of Opal. I thank you for your time, and I would like to pass it over to Raina with the Research and Training Center. Are you there, Raina? There you are.
I apologize. Hello, I apologize. Thank you. That was great, Joe. Nice to hear about your programming. I am here to talk about the Peer Collective, which is a program that we have developed. My pronouns are she, her, and I am a white woman with long hair pulled back in a ponytail, and I'm wearing a peach top, which you can't see. This next slide, please. This is funded by the National Institute on Disability and Independent Living, Rehabilitation Research, and my presentation does not represent the policies of the federal government. Next slide. So I'm just going to start first with a little summary of the problem that we've been hearing about all day, that disabled people experience additional barriers to social connection not experienced by people without disabilities. This includes inaccessible environments, transportation, personal assistance needs, poverty, increased poverty, stigma, exclusionary policies and practices, as well as access and comfort with technology at higher rates. Next slide, please. So we have been working with Centers for Independent Living for many decades now here at the Research and Training Center on Disability in Rural Communities out in Missoula, Montana. And we applied for funding and received funding in 2021 to work with center staff and consumers using a participatory curriculum development process, which really centers the voice and the needs and the expectations of people who have lived experience across the United States with social isolation and loneliness and need for supports in social connections. This is a really iterative process, and we spent over a year meeting weekly and learning from them and building a intervention that we are now currently evaluating. So this resulted in a 6-week workshop that is facilitated by Centers for Independent Living staff and peer advocates called the Peer Collective. And again, we are currently in evaluation, and we've collected data with 4 centers, and we are currently collecting data with 5 additional centers who are using doing the program in 2 workshops with a waitlist control group for evaluation. Next slide. So this is the example of, or this is the landing page of the program, again, currently being evaluated. So there will be changes coming to the site and the facilitation guide this summer. So if you decide to use it, just know that the core content is pretty stable in terms of what we've heard from evaluation, but there will be some changes. But we're excited to start to engage the community and learn how other people might want to use it. So next slide, please. So it covers 6 topics that the staff and consumers that we worked with to develop it thought were important for people. And it's really about skill building and and personal identity related to knowing your supports. And in that first session, they think about their supports and how to also set a personal support goal, which is a theme throughout the entire 6 weeks. We can't keep coming back to that of setting a goal of finding a new friends or a group to join or some other kind of social support that they need. The second session is about identifying their values and likes and dislikes related to relating to others. The third is really centered on how to identify negative self-talk and build positive self-talk and how that relates to relating to others, which is a fourth session with more relationship kinds of skill building. And then a final content is the successful conversations where they're learning communication skills. And then they end the 6 weeks with a wrap up. Next slide. So we've collected a little bit of data that we can share with you. There was 42 folks who completed a pre and post survey comparison. And so one highlight from this is that we asked people to please decide how much each person or group of people is supportive for you at this time in your life. And as you can see on the graph, the blue bars are people who said they didn't have a support in that category, for instance, coworkers at the beginning before the workshop. And in blue, following the workshop, 7 people reported that they had new supports, personal supports in that category. The orange bar highlights people who identified that they had people in that support category, but the quality of their support increased. So for instance, the 6 people out of the 42 identified that either people moved from not supportive to somewhat supportive or very supportive. So their quality of that support from neighbors improved. Overall, 67% reported a new relationship or an increase in quality. This all with a caveat that although some also reported loss of support and decrease in support quality, that's why we are continuing to complete the evaluation and we'll stay tuned for that. Next slide, please. I just want to highlight, I'll just highlight the bottom quote of, we also did interviews with participants and this person from Washington State said, I like learning about the different people and their strengths and weaknesses. And then I didn't feel so alone in my strengths and weaknesses. It really helped me strengthen my skills where I felt I was a little bit weak in before. And it also helped me know that I was a little more talented than I thought I was too. It gave me confidence where I didn't know I could have it before. So really the peer connection as well as the confidence to build supports. Next slide. So I just want to, so process lessons learned so far as a research project working with Centers for Independent Living to evaluate a program developed with centers, staff, and consumers. When we think about online, what makes people makes participating in online workshops appealing and highlighting that it's able to connect in a different way, windows into each other's lives that might not be found meeting in person in an organization, reduced transportation barriers. It also reduces energy use barriers, which a lot of folks that we interact with have chronic conditions that make it really difficult to get ready and go places. And so that's a nice piece. Supporting technology use in terms of what we've learned from that is a lot of time, patience, and relationship building, and patience and time and relationship building. And that there might be some ways to help support rolling with that resistance and using some like motivational interviewing techniques to help affirm resistance to using technology and to co-construct discrepancies with the consumers and clients to just help them identify their goals. Being flexible and being open. We also found that for some folks in our program, strictly online might not be feasible, ethical, or desired at this point of where we're at. And so just working with within those contexts and those needs, supporting our facilitators and empowering them and really acknowledging how much time it takes to support people and then funding that in a way and supporting it. And then finally, like Lucas and Joey mentioned, around peer support is a cornerstone of independent living philosophy, nothing about us without us. And additionally, just working to center and honor consumer choice and control in their lives and in their participation. So balancing that with this intervention that will hopefully show more positive results and be available soon. Next slide. I just wanted to end by sharing our contact information and to say thank you to our project director, Chris Stanley, who keeps this evaluation project organized and moving forward. And with that, I will pass it on to Rebecca Freeman in North Carolina.
Hi, good afternoon, everyone. Thank you very much for having me today. It's an honor to be here with everybody. You can go ahead to the next slide. So I wanted to just give a little bit of context. Oh, I'm sorry, I forgot to mention, I'm a white female, graying hair, wearing a cheetah top. So I wanted to give a little bit of context of how we got to where we are before I dive into our Social Bridging NC website. So in 2020, when the pandemic first began around March, April, we, being at the State Unit on Aging, we saw that there were shutdowns of senior centers, congregate nutrition sites, Meals on Wheels, et cetera, all across the state. Having come from the local level before I worked at the state, I realized right away that that meant that there were a lot of people who were probably struggling with loneliness and isolation. And so being concerned, I approached our leadership and we formed a internal at the Division of Aging social isolation work group, which later became our what we called SILES work group, which stands for Social Isolation, Loneliness, and Elevated Suicide Risk, because our work ended up expanding to include addressing elevated suicide risk. You can go to the next slide. So our very first efforts were pretty limited in scope. A lot of us didn't know what to do. And so we spent a lot of time brainstorming and hearing from subject matter experts, including someone from New York State. But we were connected with a couple of researchers who had been funded by ACL to address suicide risk amongst congregate participants in Metro Atlanta, Georgia. And so through our partnership with them, we were able to start developing some research to understand what was going on in North Carolina. And when I use the word research lightly, it was really just a survey to assess the impact of COVID and the capacity to address social isolation, loneliness, other mental health conditions, including elevated suicide risk. And from that, we found that those issues were a problem. And so we 2 summers in a row sent out trainings for both social isolation and loneliness, and then also elevated suicide risk. And those were the ASSIST and the B trainings. If you're not familiar with ASSIST, that's a suicide first aid program. And the B training stands for belonging and empathy. And that is a program that these researchers have developed to address social isolation and loneliness. In addition to that, and really what I'm here to talk about today, is we began working on a social engagement web resource. Before we go to the next slide, I will back up just a bit to say, in North Carolina, we have a very rich network of senior centers because of our certification program and our training program. And so one of the things that we require for senior centers to be certified is that, one of the things we began to require during the pandemic for them to remain certified is that they offered virtual programs. And we were very liberal with how we defined virtual. We knew that broadband was an issue. We also knew that technology was an issue. And so telephone-based support was something that we accepted for certified centers as well. But the question quickly arose, if we were having, all these virtual programs, is somebody limited to attend just in their county, those virtual programs? Why can't they attend one in a county next door or even across the state? The challenge is, how do they find them? So what we ended up developing was all in response to that challenge. We wanted to make these resources available for people in one place so that they could be easily found. And you can go to the next slide. Since 2016, we've offered Healthy Aging NC in partnership with the North Carolina Center for Health and Wellness as a place where people can find evidence-based health promotion programs, such as A Matter of Balance, such as Tai Chi for arthritis, and falls prevention, such as chronic disease self-management programs, etc. And so since that was already established in North Carolina, we felt that it was a natural fit to include our social engagement programs on this website. So we started out there. You can go to the next slide. And on our social engagement page of that website, we started to build out various things. We wanted to make sure that we were assessing people, or people could assess themselves. So we used the Lubin scale for social engagement and also the UCLA loneliness self-assessment. We then started to build out a large number of social engagement resources, including our senior center locator. And then finally, we were working on having that platform to offer virtual social engagement opportunities. Next slide. We heard early on, and I saw that somebody mentioned in the chat, a very, very important thing, which is that not everybody can access these programs. Broadband's an issue, devices are an issue, digital literacy is an issue. And so simultaneously, we worked to first advocate with our Department of Information and Technology that they start to include older adults, if they weren't already doing so, in their digital equity planning. And then we were invited by them to apply for a digital equity grant, which we received. It was about $1.12 million. And so over the course of last year and this year, we've been developing a curriculum as well as a toolkit for addressing digital equity through digital navigation. And then we will be hiring and deploying digital navigators statewide starting in July to make sure that we have people out there who can help people navigate and get the resources that they need for digital inclusion. Next slide. So I'm just sharing a screenshot here at the risk of running into slide after slide and making it very difficult to navigate. I asked if I could actually share the website. But before we come off of this, I'll tell you that around this time last year, we started talking with our partners at the Center for Health and Wellness. They had also gotten a grant for a project called the Social Bridging Project. And it was basically a telephone reassurance program. It started with UNC Asheville students, and now they have paid staff. And they had built that into a website. So the website that you're looking at on this slide now was originally the Social Bridging Project website. This, again, is also being managed by the Center for Health and Wellness out of UNC Asheville. And so they asked us if we wanted to roll our social connection information over into that website. And we said, sure, but how about let's brand our entire array of things that we're doing in North Carolina around social isolation as Social Bridging NC. And so that's what you see right now. And I think the next slide is just my contact information. Yeah. So if you can give me permission to share my screen. Let me see. And I'll have to look away from the camera to be able to do this, but hopefully you guys don't mind that too much. So if you look at our website now, you can see this is our landing page, our home page. It just has some information and kind of a snapshot of what you'll see in other pages. So I won't go too far into that. We have an about page, which just tells about our mission, and then also our partnership with the Center for Health and Wellness, and a little bit of information about aging in North Carolina. The important pages that I really want to show you, I'm excited to show you, is our resource page. Full disclaimer, we know we still have a lot of work in our resource page. We're really wanting to make sure that our page is accessible. So we're working to improve that. Just yesterday, we had a long meeting with our friends who work in captioning so that we can make sure that services are provided for people who are hard of hearing that make virtual programs more accessible. We're also reaching out to our Division of Mental Health to get more mental health resources. And I could go on and on with different people that we've been reaching out to flesh this out more. So before you criticize for things that are missing, I mean, please do put those kind of things in the chat because it will be helpful. But do know that we, full disclaimer, are on top of that and trying to make sure that we include everything that would be helpful. So we have our area agencies on aging and where they can click to find their local AAA. We have our health promotion, our Healthy Aging and C that I already mentioned. I'll come back to the Find a Senior Center because it's interactive. We have YMCAs. We have our cooperative extensions. Oh, sorry, I skipped ahead. Our local library directory, and then also mental health support, crisis support, North Carolina Senior Games, cooperative extension that I mentioned, and then some additional more national resources down at the bottom. Also our caregiver portal, which is really important for caregivers who oftentimes experience isolation. And I want to just plug in or click on our Find a Senior Center. I thought the picture was interactive, but apparently not. So this is a place where we can go and plug in our address, and then you can find the senior center that is closest to you, and down below it'll give you more information about it. So we were really excited about that because, as I mentioned, we have really great senior centers in North Carolina. And then finally, the thing that I think most of you would be most interested in is our virtual events page. And so you can see here that we have through our senior centers a lot of different virtual events that have been posted. These are mostly Zoom links. There are a few Facebook Live or other platforms on here. These are all being, and then we have some maybe by our area agencies on aging with health promotion. So these are all programs that our senior centers are already offering because they want to, but also for certification, offering through their senior center and advertising to the people they currently serve. But now they have this platform to reach people from across the nation. I mean, the state, well, the nation too, but we're really promoting it within North Carolina. So we have been, since then, and the last bit that I will share with you is that we've been really trying to promote this widely. We have had webinars with our senior centers to try to get them on board with the importance of offering these programs and not just thinking about the people in their community that can drive or take transportation to their center, but also those who cannot. We've also been talking with our partners at the North Carolina Center for Health and Wellness about how we can better reach out to other partners, because we know that there are other partners out there that could offer virtual programs. For instance, this month, for the month of May, we have the North Carolina Coalition on Aging doing something on fraud and scams. We know libraries are oftentimes offering virtual programs, cooperative extension, et cetera. And so our plan in the next few months is to try to get those folks to use this platform as well, so that we can really expand the offerings that are being provided on this page. And I believe now I turn it back over to Alex.
Thanks. Excuse me. Thanks, Rebecca. And thanks everyone for those great overviews of the work you're doing. And I think we're all going to come back on video, or the panelists are going to come back on video now. Just for a few minutes, we have time for probably one or two discussion questions that I think I'm just going to pose to all the panelists, since we have to wrap up here by 3:25. But the first question I wanted to ask you all, and feel free to hop in. I'm not going to call anyone out for this one, but based on all of your experience in virtual programming, what do you all think are the best strategies for the promotion of virtual programs to, outreach to potential participants on one hand, but also to include those who may have difficulty accessing virtual programs? Does anyone want to answer that?
I'm happy to take a stab at it since I've been talking already recently.
Sure.
So in North Carolina, we're really lucky. We have a very strong senior center listserv that we can send out information and say, please post at your senior centers. And I have heard that that's working. They have Social Bridging NC posters up at the senior center, as well as they have their own Facebook sites. Healthy Aging NC, or the Center for Health and Wellness, has a Facebook site. We've recently, because it's Older Americans Month, asked the Department of Health and Human Services to put a blast out through the DHHS Facebook or social media that they have. As far as reaching out to more people with disabilities, as I mentioned, we know we still have work to do to make our pages more accessible. And so we haven't really dived into doing a lot of outreach yet, because we certainly wouldn't want to direct people to a resource that's not necessarily accessible yet.
Yeah, that's great. Does anyone else want to chime in on that one?
I'll just say that I think if you have a program that is predicated on volunteer engagement and having folks active, cannot emphasize enough that I firmly believe that one truly engaged volunteer can trump, 10, oh, I'd like to do that volunteer. If you have that one really engaged volunteer, they will help with promotion. They'll find the avenues, they'll find the peers, they will drive it. And so I think so much of promotion for programs that, include volunteers is doing the work to build a grassroots kind of approach to advocacy that helps you narrow in on that one person who will not be the linchpin, so to say. We need to be able to have programs stand on their own, but to have that individual who can really drive that forward with the folks and speak on behalf of them and for them in so many ways. So I think that that's really important as well.
Yeah, those are great insights. I think we probably have time for one more question, and then we'll wrap up. One of the questions I wanted to ask you all, and again, feel free to jump in, is, virtual programming, as we've all talked about, has the ability to really reach populations that we may not be able to serve otherwise. And one of the things that I think is really important is the outcomes that come from that. So we saw a lot of, quotes and stories about how this work is affecting people, but what are you all doing to actually measure the outcomes and the impacts of the virtual programming or offerings that you have?
I can go first, but I don't want to be the only person who talks. So if anybody else wants to.
Go ahead, Rebecca.
Okay. Well, actually, I had meant to share this. We have on our social engagements, on our page, a link to an outcome study we did about senior centers in general. And so I just want to share this. This was a survey we did of participants of senior centers across North Carolina. We reached over 7,000 participants. So that was a really, really good number of folks. And we asked the question, it was a leading question, because I participate in the senior center, and then had a whole host of different things that we measured. I envision a time where we have something very similar with our social bridging programs. We are not there yet. We, again, have just really started to launch this, but it's really easy to get outputs out of analytics that you see on the website, but getting those outcomes is always really, really tricky. And hearing from the older adults themselves of how this program has benefited them would be the way to do that.
Raina, did you have something on that one? You looked like, or Joe, Raina, you looked like you wanted to say something. But
yeah, it was actually just trying to find a resource that we have that we created that's it's about how to tell your success stories, and it's about that collecting data and really as centers for independent living or at a state level, or and it's a really nice toolkit. I can't find it right now, but I'll share it. Just being able to define what are our goals, and then how do we measure that, and then tell the story. And we've used awesome tools like story maps with ArcGIS, which is really, they're accessible to the point we're always learning new things about accessibility, but to the point that people really like using them, and they're fairly easy to navigate to create a nice website to tell your story.
Great. Joe, did you want to add something?
Yes, kind of just to tie all the points together is like, I think the best way to measure how well you're doing is kind of the word of mouth that our other members pass on to other people. So similar to Lucas and his volunteer, one person just telling their story to another member is saying that how well that Opal, the Amputee Coalition, did for them, like that means the world to us. And I think, no, you can't measure that with numbers and data, but that's how we measure it, I think.
Yeah, go ahead, Lucas.
I was just going to add, I think the ability to pull quantitative, qualitative data and really speak to these things has to come from a great foundation that you've laid. And so that involves things like doing community asset mapping. It involves doing community needs assessment. Unless you know where you situate your program, the data that you get and the way that you promote is always going to be slightly skewed from where you need to go. So I cannot emphasize enough the importance of doing the foundational work, thus to see the payoff later on in the data.
Yeah, totally agree with that. So we are running out of time. The panel went really quickly. I really want to thank Rebecca, Lucas, Raina, and Joe for sharing all the information about your work. I know Meredith and team at US Aging will be sharing all the resources out, but I think this is a really important topic, and there's so much work to be done in engaging people with virtual programs. And I think us working on it collectively and sharing these insights will only broaden opportunities for people and include people even further. So thank you so much. And I'm going to pass it back over to Meredith. Thank you all for being here.
Awesome. Thank you. That was such a good discussion. I really appreciated hearing the questions that Alex flagged to the groups and then all of your responses. But we're coming to a conclusion of this summit. It was so exciting. I think we heard from such an incredible group of amazing leaders and innovators over the past 2 days. I hope all of you in this virtual room, again, learned as much as I have over the past 2 days. And I hope, like I hope you also take what you learned back to your organizations and communities and look for opportunities to incorporate it into your social connection work. So we're just so appreciative of you joining us in this summit. Like all of you on the line, we're all kind of doing our part to help ensure that older adults and people with disabilities and caregivers have the ability and have the supports in place to remain connected and stay engaged with their family, friends, loved ones, and their overall community as well. So as you continue on your journey to promote social connection and engagement, I hope you stay connected with Commit to Connect and the Engaged Resource Center. We have, of course, our websites, which we've shared in the chat throughout the summit, and that's just a great way to stay connected with us. Sign up for our newsletter, definitely join that Commit to Connect nationwide network of champions. That's such a great platform for continuing to engage and dialogue with your peers all across the country. So soon we will be sending a follow-up email that will contain links to the recordings from both days. And that email will also include a survey evaluation link, which we'll also place in the chat now. But if you could take a moment to complete that survey, either now or afterwards in your email, that would be great. And that will help us shape our future events and offerings and make sure that they meet all of, that they meet your needs. So keep an eye out for that. And I see the link is in the chat now. The chat is hopping, so you might have to scroll up a bit. But before this National Summit comes to a close, I want to turn to Katie Clark with ACL for her closing remarks as well. Katie?
Thank you, Meredith, and thank you to US Aging, my colleagues at ACL, and all of our speakers for your partnership and support with our annual National Summit to Increase Social Connections. And a huge thank you to everyone in attendance for your energy and your engagement during this annual event. For many of us, social connection is at the heart of our programs and our services and our policies. And we really hope that this summit provided you with resources, introduced you to champions of this work, and also shared innovative program examples, all focused on how to leverage technology to promote social connection. We all have a role to play in promoting social connection, and really our work is just getting started. As Meredith noted, we encourage everyone to browse and replicate programs from our Innovations Hub, capture the social connection outcomes of your programs, collaborate with the growing and almost 500 professionals in our nationwide network of champions, browse our resources on our website, sign up for the Commit to Connect newsletter to stay in touch. Together, we can address barriers and facilitate social connections of all people, including older adults and people with disabilities, for a healthier future. I really look forward to the these future shared efforts. And just thank you again, everyone, so much. Wishing you all a wonderful evening and week.